Hello and welcome to our collision conversation on investing in digital healthcare. It couldn't be a more perfect time to discuss this a year or so into the pandemic, except for perhaps a year ago. But our two brilliant investors, Hans Tung and Rebecca Lynn, are going to make up for any lateness in our conversation with spinning us a lot forward. So I'm thrilled to have both of you here. You have such amazing track records and you're such thoughtful thinkers about the healthcare space and the consumer space even more broadly. Rebecca, I want to begin with you because you've talked a lot about this idea of investing in core root causes of health, functional medicine. Talk a little bit about how we can actually make that happen, because we've been talking about that idea for a while.
No, I have. I think in terms of making that happen, there are a couple companies out there really going towards this today. They're fairly early stage. So one is really embracing functional medicine, and there are a number of functional medicine practitioners out there and having a platform for functional medicine. The other one is really getting at the scalable data analytics and applying it to actual patient care instead of sort of upcoding programs, which is what a lot of it has been applied to thus far. So I think those two things, the platform for functional medicine, and then also the scalable data analytics platform.
Now, we actually talked a little bit about, just in my intro, that this is getting to the root causes, but just to help us understand the difference between functional medicine and just plain medicine.
Yeah, absolutely. So medicine is largely governed by pharma, I would say. So you eat a lot of the wrong stuff, you eat the sugar and everything, you gain about 50 to 100 pounds, and then they're right there to meet you to help put you on diabetes medication, right? And monitor your diabetes program and try to bring your H1C levels down. Functional medicine is very different. They ask what caused you to be sick in the first place. What was it from a behavioral change, an environmental change, or a genetic issue that may have caused you to actually first get sick? And then they deal with it from that basis forward. And they deal a lot with like the gut microbes, the idea that 80 to 90% of all of our neurotransmitters in our brain are actually created in our gut and our gut microbiome, and that factory of where they're created, if we feed it the wrong things, will actually impact our mental and physical health tremendously. So they start a lot from that basis.
So that's actually really helpful. Hans, when Rebecca talks about behavior, it makes me immediately think about this sort of the thing that the consumer controls. This is sort of, again, putting the patient, putting the consumer in the driver's seat of their health. This is an area that you've come from in your investments, really on a broader consumer space rather than so much as a healthcare space. How do they intersect?
Right. And Rebecca definitely has to spend more time in healthcare in particular. For me, I come from more of a broader consumer lens. I led our investments in Peloton, Slack, Musical.ly, which turned to TikTok, and then StockX and so forth. So what I understand is how consumers react to things. I became an investor in K Health in New York, and then Color Health in San Francisco Bay Area over the last 4 or 5 years. And just seeing how with COVID-19 and acceleration of adoption of digital technology, and seeing hospitals and other medical groups being more willing to partner, we start seeing a breakdown in sort of barriers to allow what Rebecca was talking about earlier. So having sort of intersection of IT and healthcare happen at a pace that we have never seen before. And that gives consumer a lot more control, at least access to what they're supposed to be getting.
Yeah, the other part of digital healthcare we often think of as our cell phones, our mobile phones that are these amazing digital tools that connect us with everything and a huge amount of data. But it's that data is the second part, and we often talk about this vast amount of data that's available at our fingertips, but so much of it isn't accessible. So much of it isn't interoperable in the healthcare system. Rebecca, this has been something that you've had to deal with as an investor.
Yeah, no, absolutely. I mean, we started, a decade ago and kicked off this whole conference called DC to VC to really educate the venture capital community on Washington policy, right? And a big piece of that, more than a decade ago.
I'm sorry, there is a Washington policy? You're suggesting
Washington
there is
policy.
one. No, but
yes. Well, it changes for every half an hour or so, but here we are. And so anyway, so back then, there was a ton of talk about the blue button and FHIR, and we're going to have this whole interoperable health system, and we're going to have data all in one place, and it's going to be shared. And you fast forward, a decade plus later, and we haven't made a ton of progress, and we continue to look for that. We're getting there. We're getting closer. but there's still a lot of friction points. And I've said in the past, you know, the antitrust action against Epic and others is probably what it's going to take on the government level to actually truly see that accessibility to data. And Practice Fusion was one of my first deals in health tech. So it's the largest cloud-based EMR. It was acquired by Allscripts. And really the thesis behind that investment, even back then, was this accessibility to that core data to help inform better decisions.
Yeah. I mean, you know, one of the things that, you know, people get so frustrated about is how hard it is to do anything in digital health. You know, when you think about just the access to being able to say, you know, book a room in somebody's home, Airbnb. Hans, you were an early investor in Airbnb. I mean, just the concept of just disrupting the entire hotel industry and saying, yes, we can use the data and tools that we have and the consumer at the center of all this and make this happen. And yet we have such trouble doing that in healthcare.
Yeah, with healthcare, it's so regulated and data sits in silos. And it just gets, because it was really hard to be able to apply analytics to something when you don't have enough data to analyze, and data's not available.
And the data is largely garbage too. I mean, the claims data is messy, right? It's full of garbage. The EMR itself is incredibly unstructured and not super helpful in a lot of ways. There were
Correct. So now with COVID-19, it has become easier to have more access to data and also get better data if consumers are willing to share and so forth. And that's what we saw with Collar as well with K-Health. Collar is now partnering with California State and Massachusetts State and Harvard Medical School and Stanford Medical School, and they're doing 75% of the testing for COVID-19 in California. And on top of that, they're also providing more software and services on top of the data they're collecting through testing and so forth. So this is a sort of new era in it, even though we've been talking about it for a long time. Finally, we're seeing some breakthrough, partially due to COVID-19.
Partially due to the amended regulations, right? I mean, partially due to paying doctors the same now for telemedicine versus not, right? That was a huge issue before. Breaking down the barriers to the interstate kind of practices, and doctors being willing to sort of accept it themselves and adopt it themselves. So we've seen that with Doximity. Doximity filed to go public, so I can't say a ton, but they have over 100,000 doctors on that platform, and they only started doing telemedicine in Q2, right? And it was just like the sea change was instantaneous. What?
They had 1 million plus telemedicine visits in just the second quarter. You mentioned at one point. I mean, just a huge, and right when COVID
100,000 doctors, right, on that platform, and they only launched in Q2, and so that never would have happened had the legislation not changed with COVID-19.
So we needed a crisis to help spur these changes in legislation,
I think
the urgency that we have. Well, we know that we have this urgency, and we know that this pandemic isn't even over yet. In fact, we're seeing some surges here. We're already seeing some, tremendous, evolution in the way that consumers are taking charge of things like, and we've talked about this in the past, but Livongo and telehealth, and that behavioral, that ability to really take control in a disease like diabetes, where there is so much of a behavioral component to this, what you eat and how you manage that. So what is the next area that we're going to see that sort of behavioral health kick in, or at least some consumer directed care kick in?
I mean, we're already seeing it in therapy, right? And teletherapy. And this was one of the first things that I thought back, a decade ago, was the sort of most obvious, was the teletherapy. And so we're seeing that on all fronts. And Vita has a component of teletherapy too, right? Their thesis is you can't just do one thing. You have to manage diet and weight loss and diabetes and therapy. And it's one sort of continuum of a patient, which is what my core belief set is. So I do think you're going to continue to see teletherapy, like therapy and mental health in the telemedicine bucket. My newest investment is in the vet medicine. I think telemedicine they serve people, but I think it serves the vet world perhaps even better. And so that's another key area. And then I also think this remote patient monitoring as a whole. across, so this remote patient monitoring, which is really touchless and people don't have to think about it. So I grew up in the CPG world and the number one mantra is don't make the consumer think, right? And the more you can do where they don't have to interact and they're just getting little touch points, I think the more behavior change we're going to see.
And Hans, that was Steve Jobs' thinking, would just make the iPhone as simple as possible with one button. Don't make people think,
Yep.
Yeah.
And that's why on one end, you start seeing Calm and Headspace. We made an investment in a company called Loop. A lot of, you see Prince Harry speaking on behalf of Better Up. You see more and more companies addressing the issue of mental health on one end. On the other end, you're seeing specialty care become more available online as well. What is K-Health is trying to do that with medical groups in Israel and in the US. We also are seeing communities emerging, like the Mighty in LA, that have millions of users on it. And these are families with kids that have specialty kind of conditions that are hard to find, and they are permanent. And so you need a place to share notes, share stories, and share inspirations with each other. So as smartphone penetration continues to rise, there are more and more services possible than ever before.
That's a powerful idea. My friend, the late, great Bernard Tyson, who ran Kaiser Permanente for years and was truly one of the most prophetic healthcare thinkers that I've ever met, used to talk about this idea that we were separating the head from the body in medicine. That we had two different ways of treating them, that people would go to two different kinds of care, providers, two different systems for billing.
And they're all linked together, right? And by the way, your gut is actually what creates all those neurotransmitters going into your brain. And it's completely linked through like a nerve system, between the two. I mean, they're completely tied together. So and it makes no sense to divide it.
Will we see that happen more in digital health? Will we see this unity?
I mean, we are, that's what Vida's doing largely, right? Vida Health. And then that's again, when I talk about the functional medicine plays, we're starting to see it. And then we also did, oh my gosh, what's it called? It's a microbiome play as well in the prior Morgenthaler fund, which I firmly believe in, like the issues around the microbiome and how it affects our overall health.
Yeah, as more consumers come online, they need more help, and help has to be more integrated. And so both the body and the mind need to be treated. And we're living increasingly in a very extremely polarized world that we all see every day on news. So this is definitely the time for this kind of functional help.
One of the other things this is time for is, and not to get dark here, but some fraud, some abuse, some waste.
Totally. Oh my gosh. I'm glad you brought that up.
Yeah.
What was it like? One of the cases you cited was like a $2 billion hit already in telemedicine in Medicare due to the telemedicine sort of uptick.
Yeah.
Yeah. The fraud, waste, and abuse is a huge, huge, huge area. And we've been looking really closely at a company here. And it's one of the first things I looked at when I cracked open digital health about a decade ago was this fraud, waste, and abuse issue. And even then, the estimate was 20 to 30% of Medicare is fraud, waste, and abuse, right? And it's just obscene, and that's what 22% of our overall GDP, our overall budget, right? Going into medicine, that number is just tremendous, and we have to just do a much better job of getting a hold of that, and then not also standing in the way of care, because so often it's a tail wagging the dog issue, right? And then they're like, oh, well, you don't need that $5 test, to see if, you have a thyroid issue, which I dealt with in the medical system. That we don't want to over-test people. And that's just like a really stupid, like tail wagging the dog situation, right? But what we can do is really get on top of, the abuses in telehealth, and I don't even think you can apply AI and machine learning, but they're so obvious, you don't even need it right at this point in time. I mean, those are at the margin. These fraud, waste, and abuse cases are fairly glaringly obvious, and we just really need people and oversight to go in and do something about that.
Hans, you were talking before about this fantastic patient resource that you're building for people with rare conditions and diseases, for them to get together. This idea of the wisdom of the crowds is such a powerful one, and has really driven so much of our digital infrastructure. Tell me a little bit about how that's working in digital health.
Sure. The Mighty is a company that's based in LA, and the founder, his daughter had a rare condition, and he tried to look for feedback data from WebMD and other traditional sources. And there's a lot of hard facts, but not enough to share emotionally what people with this condition are going through. And not enough people share how they cope with it every single day with all the ups and downs. And so when you build a community that is people willing to share and provide a lot more anecdotes, not only is it useful for patients to go through and the families learn how to deal with it, it also provides rich amount of data for pharma and other people to be able to look at it and test the new drugs and new approach to care to see how families and patients respond. So it is
like
just something that
that.
makes a lot more possible than before. And when you read these stories, they're heartwarming and heartbreaking at the same time. And it really touches us in a way that make us feel like we have to invest in it and help them to scale.
So there was a company called Patients Like Me that it sounds like that was, I mean, it's been in existence for a while, but very
Yeah,
interesting.
we met them as well. The Mighty is significantly bigger. And so it is definitely an interesting category that we're looking at. And I think the more will be done, and more companies should emerge out of this category that do more for the greater good.
Yeah, and as we start to see, this data being provided for companies for things like drug development, for data analytics, for even just tracking where people are, of course, this raises privacy issues, and it raises, some concerns among consumers. How do you resolve that as an investor when you're thinking about that? How important is that for you to be considered?
It is extremely important. For what is
Yeah,
investing in companies like TikTok or companies like the Mighty, users have to give consent, and that's just a starting point. I'm sure Rebecca have more points to add as well.
Yeah, no, I totally agree with you, Hans. Users have to give consent. I think healthcare, it's sort of the, and I had sort of like pulled back from it for a couple of years because I was a little bit, I guess, repelled by the fact that, you have to always think about who's paying, right? Where is the bottom line dollar coming from? And most of the time it's pharma, I will tell you. And so a lot of these companies, and this is where some of the earlier companies ran into problems, they really want to serve the end patient, right? And serving the end patient might be more of a holistic functional medicine approach, but pharma is really who's paying the freight. And so some of even the public companies ran into that back in the day, where they wanted to do something to serve the doctor or the patient, but they really had to pay attention to what the person paying for it was saying, which was more than likely pharma, or maybe in some cases it's the payer, the providers or whatever. And so it's this really odd ecosystem. You get the patient, the payer, the provider, and it's how that interplay really happens. And I also do a lot in fintech, and so I always follow the money, right? And figure out kind of how that interplay happens and where that goes. And you have to get everyone involved in the conversation. You can't forget one leg of that stool, and if you do, you won't have a very interesting company.
Right. Yeah. And also it's become encouraging to see that there are more ways to monetize beyond pharma as well. Pharma is definitely a huge piece, but as you expand and go after the enterprise accounts, and then some of the consumers willing to pay out of their own pocket for subscription and other things, the possibilities are emerging. And there are other categories adjacent to pharma, but not pharma themselves, that are also willing to pay for data and so forth. So all the caring aspect of it. So it is a much more, you see a plurality of ways to monetize them before.
Yeah, that's kind of what caused me to step back in a big way. You're seeing that change in that patient behavior, right? You're seeing the willingness with some pockets to actually pay for their healthcare and actually do something about it. So
we also, as a business journalist, we also talk about following the dollar, and that's sort of where the heart of the story is. But in healthcare, there's also something, and again, to harken back to my friend Bernard Tyson, used to talk about owning the healthcare dollar and how fundamental that is, because when you're taking a little piece of it, you're always responsible for somebody else's part of the pie too. They can change that on you, the business model. So we only have about less than a minute left. Talk a little bit about how you can invest in an area where you feel like you've got enough runway where you don't have to worry about other players in the system. We only have about 20 seconds now. So maybe just some final thoughts here.
Yeah, I mean, I think the future for investing in healthcare has never looked better since I've been in venture, to be perfectly honest. I mean, you're seeing some real things change in the ecosystem to shift towards more innovation, I would say, in the healthcare ecosystem. You're seeing more rapid testing options for at-home testing and protocols, and you're seeing the adoption of telemedicine. And my hope, this is the big question everyone has, is what is CMS going to do? Are they going to roll back? How much pressure are they going to get from the industry and from providers and payers to roll back those regs? And so I think we're all in a holding pattern right now to really see where CMS lands, right? And what the next 10 years is going to look like.
Yeah, for me as a global investor, we're definitely seeing digital health as a trend on a global basis, not only in the United States. And secondly, as a sort of consumer investor, we also have a thriving enterprise practice. So we're seeing practice in SaaS, in enterprise, and consumers spilling over to digital health. And we already saw with the IPOs of the fintech companies like Affirm making changes in neobanks coming up, changing the fintech industry and financial service industry being affected. And now we're seeing that in digital health impacting the way medicine's being practiced. And so you're going to see a lot more medical groups online than ever before over the next 10 years. And that's extremely exciting.
Hans Tung, Rebecca Lynn, thank you. That was truly a great collision of ideas, and we're going to leave it at there.